Amina starts her morning the same way every day, leaning over the bathroom sink, plucking dark, coarse hairs from her chin. She spends extra time applying concealer over the painful breakouts along her jaw, and she tries not to look at the hair she just pulled from her brush. She has been working out more and eating better than ever, yet she feels heavier. It is as if the effort she puts into her health isn't reaching her body. Looking at her calendar, she sees her period is 3 weeks late again. Amina feels a familiar sense of shame, wondering why her body refuses to follow the schedule it is supposed to. If you are living this, please know that these symptoms are not your fault. They aren't the result of a lack of discipline or poor self-care. These are the clear signs of Polycystic Ovary Syndrome, PCOS. It is a widespread condition affecting about 1 in 10 women globally. Amina isn't failing. She is managing a medical condition that millions of others share. These changes to her skin, hair, and weight are all connected. They are driven by a specific shift in her internal biology that started long before she ever looked in that mirror. Part of the confusion comes from the name itself. Polycystic makes it sound like you have harmful growths on your ovaries. But for most women with this condition, that isn't the case at all. Because the name is so misleading, many experts want to rename it entirely. They prefer a title that focuses on how the body handles hormones and energy, which is where the real story lies. This is a system-wide imbalance. It isn't just a reproductive issue. It is a change in how your entire body processes its internal chemistry. This diagram shows our first biological factor, hormones called androgens. Every woman's body naturally produces them. However, a body with PCOS produces a higher amount than the system can easily handle. That extra volume of androgens is what causes Amina's hair and skin to react. It forces hair follicles on the face to grow thick and dark, while causing the hair on the scalp to thin out. It also tells the skin's oil glands to work overtime, leading to breakouts. These changes are just the visible evidence of an internal chemical shift. They have nothing to do with your hygiene or your beauty routine. They are purely biological responses. The second factor is something called insulin resistance. Usually, a hormone called insulin signals your cells to take in energy from the food you eat. But here, the cells stop responding to that signal. They become hard of hearing. Because the cells aren't absorbing that energy, your body stores it as fat instead of burning it. This leads to stubborn weight gain and a constant feeling of exhaustion because your cells are essentially starving for the energy you've already eaten. When you combine that energy struggle with high androgens, it creates a kind of chemical static in the ovaries. The monthly signal to mature and release an egg gets drowned out. Because that egg is never released, the monthly cycle is interrupted. This leads to skipped periods and can make it much harder to conceive when you are ready to start a family. This constant biological friction takes a toll that you can't see. It changes the way you feel emotionally, leading to struggles with anxiety and depression. Every symptom, from the weight gain to the mood shifts, stems from this same hormonal imbalance. Just one small change in the body's internal chemistry creates a massive ripple effect across your entire life. The turning point for Amina comes when she finally shares these symptoms with a doctor. Hearing an official diagnosis means she can stop guessing and start acting. The relief of knowing exactly what is happening is visible. Getting that answer early changes your future health. It allows you to address the root causes before they lead to other problems. If the condition is left alone, the high insulin and internal stress can lead to a higher risk of type 2 diabetes and heart disease over time. Diagnosis gives you a map. You have gone from wondering why your body is acting this way to having a clear understanding of how to support it. The first step is often about how you move and eat. Finding a sustainable way to help your cells hear those insulin signals again can naturally help balance your system. For those not trying to get pregnant, certain medications can help regulate the system. They lower those androgen levels, which clears the skin and helps restore a regular monthly rhythm. For women who are ready to start a family, there are specific treatments that help the ovaries overcome that hormonal static, allowing them to release an egg and making pregnancy possible. Amina is still the same woman she was, but she moves through her day with a different kind of confidence. She understands her body now, and she has a plan that works for her. PCOS is a biological reality for millions, but it is a manageable one. By reaching out and finding the right support, you can reclaim your health and live your life on your own terms.